What is the value of your independence and quality of life? We all want to feel strong and lead healthy lives. The human body, like any machine, undergoes wear and tear. As it ages, the body becomes susceptible to many ailments. One such ailment is known as peripheral vascular disease.
I'm Wing Commander D.N. Gopal. It was sometime late in 2002, I realized that I used to have pain in both my calf muscles while walking. I was referred to a vascular surgeon who then directed me to get a color Doppler done, and finally it was diagnosed as bilateral popliteal artery aneurysm in both the legs. Surgery was carried out finally in August 2003 on both my legs. They put a graft just behind my knees in the popliteal artery. So there was a very nice relief and all. I've been living quite comfortably, leading a normal life.
A community-based survey done by the Atam Swasth Foundation near the NCR region revealed an overall prevalence of peripheral arterial disease to be close to 20%. Peripheral vascular diseases, or PVD, are diseases involving the arteries and sometimes the veins of your limbs. The lower limbs are involved more frequently than the upper limbs. The underlying problem is a reduced blood supply to the tissues of the limb. This usually occurs due to the progressive narrowing of the arteries with age and deposition of fatty material in the arterial wall. Atherosclerosis, an inflammatory process, leads to this narrowing of blood vessels. It causes either sudden or progressive reduction in blood supply to the limbs. The most common symptoms are cramping pain in the calf, thigh or buttock on walking, which is relieved by rest, severe burning pain in the toes or foot all the time but more severe at night or when sleeping flat, blackening of toes, non-healing ulcer on foot or leg. People who smoke or have smoked in the past, people who have had heart problems, angina or a heart bypass, people with high blood pressure and long-standing diabetics are at great risk. It usually affects people over the age of 50. Other common conditions include aneurysms, diabetic foot wounds, varicose veins, and deep vein thrombosis or DVT. Evidence-based medical treatment is available and can help the right patient. Peripheral bypass surgery, believe it or not, has been around for the last 50 years or so with proven results. Modern technology is now giving us options that we can offer to the suitably selected patient. Diabetic foot, as a generic term, covers a whole range of foot problems in patients with diabetes mellitus. Due to reduction in blood supply and abnormal sensations, as well as a tendency towards delayed wound healing, infection or gangrene of the foot is relatively common. Gangrene is the blackening of toes and signifies death of the tissues. Foot ulcers in diabetics require a multidisciplinary approach, usually by vascular and foot care specialists, as well as the diabetologists. Serious complications can be prevented or delayed in long-standing diabetics by proper advice and care of the limbs, in particular the feet. Optimal control of blood sugar is mandatory, over which one must wear proper footwear and offload pressure on the foot. Proper care and timely treatment will give you the best opportunity to live a disability-free and good quality life. An aneurysm is a localized blood-filled dilation or ballooning of a blood vessel caused by weakening of the blood vessel wall, which may be secondary to atherosclerosis. Aneurysms most commonly occur in arteries at the base of the brain and in the aorta, the main artery coming out of the heart, a so-called aortic aneurysm. The bulge in a blood vessel can burst and be potentially fatal. The larger an aneurysm becomes, the more likely it is to burst. This condition can be treated satisfactorily by a specialist if detected at an early stage. Accurate assessment by modern imaging is a preliminary requirement in planning treatment. Surgical treatment in appropriate cases has stood the test of time and produces most sustainable results with a small risk of complications. However, today, technology helps the vascular specialist to plan and execute minimal access treatment in carefully selected cases. A stroke is the condition of a transient or permanent loss of body function, secondary to loss of some part of brain function. Disturbance in blood supply and/or blockage in a vessel secondary to a blood clot or debris is the cause in a majority of cases, the other being a bleed in the brain. High blood pressure and raised cholesterol levels remain the two most correctable high-risk factors to prevent this catastrophe from occurring. Definitive treatment for a tight narrowing in the blood vessels carrying blood to the brain results in stroke prevention. Once again, surgery is a time-tested, evidence-based tool in the hands of the vascular specialists, but technological advances are providing us with options for a subset of these patients. Varicose veins are abnormal, elongated, tortuous, unsightly blue channels usually seen in the lower limbs. The symptoms for varicose veins are visible tortuous veins, aching pain in the legs or calf, swelling, skin color changes. Correct surgery results in minimal chances of recurrence. The vascular specialist can, however, use laser treatment as well. This is more patient-friendly. However, long-term results are still being evaluated.
Percutaneous entry is made into the vein at the desired point using a 16 or 18 gauge needle. The transillumination of the red laser aiming beam through the skin indicates the correct placement of the fibre at the cross point below the saphenofemoral junction. There'll be no scar as entry into the vein is by catheter. The patient's leg is dressed with a compression bandage and a compression stocking will be worn for several days.
Deep vein thrombosis or DVT is the formation of a blood clot or a thrombus in a deep vein of the limbs. There is a small but significant risk of the clot traveling to the lungs, causing a life-threatening condition. Obesity, cancer, recent surgery and prolonged air travel, the so-called economy class syndrome, warrants more attention from us. Both the patient or the potential patient and our colleagues in other medical specialities need to realize we can only diagnose if we look hard enough. Duplex with color-coded triplex scanning. This is a very patient-friendly, non-invasive technique. It, however, requires a trained expert to do it because the results are totally operator-dependent. The treatment for DVT includes techniques like blood-thinning drugs, compression stockings, and when indicated, will need protection from blood clot migration by a device. As we can see, there exist a number of options to diagnose, treat, and rehabilitate patients with peripheral vascular diseases. It is important to appreciate that the onus of responsibility to select the correct patient for the correct line of treatment remains with the vascular specialist.
Some 7 or 8 years ago, my GP discovered that I had an aneurysm in the abdominal aorta. It's not a particularly unusual condition in somebody who's had a fondness for food and drink throughout his life. In actual fact, what he discovered was a lump in the stomach which should not have been there. And he advised me to see a vascular surgeon, which I did. My surgery for the aneurysm was in 2002, and we are now in 2008. And I reckon that for my age of 77 years, I'm doing fairly well. I play golf every day, I go for walks, I swim, enjoying the company of my grandchildren and my children.
मेरा एक्सीडेंट 15 जुलाई 2007 को हुआ था पंजाबी बाग फ्लाईओवर के ऊपर। फिर मेरे को दिल्ली पुलिस वाले उठाकर संजय गांधी मेमोरियल हॉस्पिटल में ले गए। वहाँ पे डॉक्टर ने चेक करने के बाद बोला कि इनको वैस्कुलर नस कट गई है, जो 3 नस जाती है घुटने से नीचे। फिर उन्होंने मुझे LNJP हॉस्पिटल में ट्रांसफ़र कर दिया। LNJP हॉस्पिटल में डॉक्टर चेक करने के बाद बोले इनका पैर का जो एम्पुटेशन बहुत ज़रूरी है। डॉक्टर ने फिर मुझे वैस्कुलर ट्रीटमेंट किया, तब जा कर के मेरा पैर बच सका। उसके बाद मैं आज अपने पैर पे ठीक से चल सकता हूँ।
The vision of the Society of Vascular Specialists, or the VSI, is to become more visible, approachable and user-friendly for the people who are most at risk of developing peripheral vascular diseases. Our take-home message is a positive one. Just as you would not want your independence or quality of life threatened, we, as providers of specialist care, would like to show you how these can be preserved for